education.
Yes.
And I'm wondering how your background in physical education was combined with your work in dance therapy to work with the children.
You know, honestly, I don't know how you really can work without a physical education background. Because for me, it was one. For me, music and dance is one, and movement and physical training is another one. And I was very much surprised when I found out that physical education for especially boys in America is ball playing. Now, we had sports, you know. We had what you call here soccer, I think. We called football, you know. That was our main big thing, and we had international games. But otherwise, physical education was knowing about your physique. And you had to learn how your body is constructed. I mean, I feel to know about your anatomy is very important. And that way, for instance, with boys, especially if you had emotionally disturbed, not with one that were withdrawn, who were afraid of movement. With them I had to be careful. But with the one who were hyper, I only had to find movement that responded to them and controlled them.
So it sounds like you drew from your understanding of the body, your understanding of physical education, to use their bodies in the dance therapy session. So you really drew from that discipline and combined it.
Definitely, definitely. Well, I never forget it. That is unforgettable. I worked in an institution where the children slept.
Do you remember the name of that?
Yeah, it doesn't exist anymore. Childville it was called. And we had our first school in Brooklyn, and I think they made it now a dope withdrawal center or something. And it was in the worst part of Brooklyn. And I had very lively boys, very lively boys. And there is all right, one of my stories about Pim in one of my articles is how this boy I only could approach in the beginning purely to know that his foot didn't work. He didn't even know he had feet. So my knowledge of his anatomy, so to speak, got me to the point that he ended up with a handstand. But I had to know what this child needs: footwork, balance, learning how to use his arms and hands to develop strength in them and so on. So it was, I worked only with anatomy, so to speak, to help him to express himself. And the way how his last words were to me when I said, I will bother you again, but do one more handstand. He said, Mrs. Polk, you didn't bother me. I learned a lot with you. I mean, this is one of the triumphs of my life. This boy, when we got him, and of course it was not me, I mean, we had a whole group of people worked on him, that he was not conscious that he had feet. And now he makes a handstand and realizes he has conquered his body and his self-control. I mean, this is a healed. I don't say I can heal. I will never claim I can heal. But I can help to make them happier. I would say happier.
Yes. And how would you describe that work in relation to, I guess, but the difference between the physical exercise and it being a dance therapy experience?
Well, a physical education teacher.
And I guess what you're saying, what's the difference between physical education and the dance therapist?
A physical education teacher, and I worked with them,
Yes.
is concerned with a physical goal.
Mm-hmm.
You teach the children how to run quicker, lighter. You teach the boys, we will have science about it, how to develop the arm muscle, how to become conscious to throw harder. That's physical.
Yes.
I know if he knows how to throw faster and wider, he will feel good, and maybe he will feel better when he can run, and he will be popular in his group because he runs faster. I don't work with certain physical things for their physical success.
Yes.
I work for them only what it will do to their feelings, to their self-image, because I think that is the most important thing, that everyone, every human being has a good self-image. If I feel lousy, I have a bad posture, I talk nasty, I'm not an image of God's creation. But if I feel good, and I have done something good today, and even if a little something, I have achieved.
Yes.
And I have achieved it because I worked on it.
Yes.
You see, the success for a boy who had never really been considered a success, and that is the one child that I had in childhood, when he, that was another boy, saw obviously on a television something, a flip. And thanks to my training, honey, with men, I dare to help with a flip. He said, "Can you teach me a flip?" And I said, "Of course." So he said, "You really can?" And I said, "Of course, but you must work on it." "Well, I will. So let's start now." I said, "No, now we can't, because now your classes are coming. But if you want, next week I come an hour earlier, and I will stay an hour longer, and we can work on it." He came next week an hour earlier, and I started, of course, having him on the floor lying. He said, "I shall lie on the floor?" I said, "Yes. And now put up your legs. And now push up your behind." I spoke very plain with these boys. They used a very plain language with me. And then I said, "All right, put your hands behind you." And we got into a bridge position from the floor. So he worked a little bit. I said, higher with your behind, higher with your behind. I went to him and pushed up. So after a while, he got into a real bridge.
Yeah.
So I said, "You practice that, and then I will go on with you." And he practiced it. And then I said, "Now, do you think you can come closer to your behind with your hands in back?" And closer and closer. And I said, "All right." Now I swayed him a little bit, and I helped him sway, you know, until I felt he really had enough strength to get up from that position. And I said, "Now you have to practice that." And of course I held him down and up. And I saw that bird really had a tremendous strength. So I said, "The next time you lift your arms up and come up." And we got it. So from that moment on that he learned to make a bridge. Then I said, "Now from the back you bend forwards and lift your leg." In that one day, this child had started with me early in the morning And at 6 o'clock, when I had closed, he came down. I want to show you something. So I said, well, he actually flipped over.
Remarkable.
My heart stopped. Honey, my heart stopped. But he had really systematically gone from the back bend into the handstand. Yes. Well, handstand I had worked with the others too, and he had seen it. He had come over to it.
Yes, and he felt wonderful about himself.
No, I mean, he was from that day on, of course, the crown of creation for the whole school, you know, and every boy wanted to learn it. Yes. Yes. But the other boys, of course, didn't have this fantastic determination and body. He had a fabulous body. But we worked towards it. As you see, I got with Pip, that I call it, you know, who said, I have learned something, yes, to the handstand. Yes. I got him to the handstand. Yes.
And for the other children who weren't quite as physically adept?
Well, we did other things. Of course, we became, for the girls, we all became. At that time, I mean, right now I don't think it would be so popular, but we became queens and princesses, and the boys knew a little bit about Canadian, so they became Prince Charles, you know. And I mean, you worked with props. I brought paper crowns, I brought old curtains for the ropes. When we worked with everything as a prop. Everything.
I actually learned how to use props from working with you back when I was in college. And one of the things that I know is the importance of using props is the prop becomes the extension of one's own body. And also the prop is often easier for an individual who has difficulty communicating with an individual. The prop is an easier modality to interact with. And I really learned that very much from you. Can you speak more about how you would actually use a prop in a session?
Well, I showed you the story with the candle, for instance.
Another example.
Well, props that I used, again, for boys. It's funny that I talk so much about boys. You would think I should talk more about girls. But when you get into the field of therapy in institutions, we had a majority of boys, I think almost 3 to 1. And it's my personal, which doesn't interest anyone, thought why the girls are in minority in institutions. They are more subtle. I feel
you mean their disabilities are more subtle?
They hide. The boys are so obvious when they are disturbed in any sense. If a boy is shy and doesn't want to do anything, you know that's not normal. And when a boy is aggressive, and then it becomes dangerous, you know. For the girl, it is completely different. But the emotions that props give, for instance, I had somebody from the Board of Education watch one of my sessions. It was the life skills schools. And at that time, I mean, we never knew if somebody comes. They came as a surprise to find out if we do well, you know. I used, and that was a heavy class, on a table, I loved plastic, I think. They came in all colors for soap things. Yeah, you know, these plastic bottles in blue and red, and I put them up like you would think of pins. And I put them on tables. And we changed